Hi there. So we're going to be talking now about the nursemaid elbow. Why is it called the nursemaid elbow or the babysitter elbow? Is pretty much because here we have the elbow joint. We have three main bones. So we have the humerus, the radial bone, which is found laterally, and the ulnar bone. Together, they make up the elbow. This is an anterior view, and in pediatric orthopedic chapter, we have a part called the nursemaid elbow, which is pretty much when a small child is lifted by the hands or the distal part of the arm, and it causes pain to the child. And this happens in the first 5 years. So infants, toddlers, small children that are lifted by maybe their older brothers, sisters, babysitters that are not experienced. So what happens anatomically is the head of the radial bone, which looks like a cylinder, is usually wrapped by the annular ligament. And being wrapped by the annular ligament is all good and fine, but before the fifth year of the child, due to inadequate development of the bone, this can slip. And the medical term for all of this is the radial head subluxation. So this head can slip, the head of the radial bone, and this can cause pain. So what do? The child will present to their primary physician, we take a history, and we ask, well, what happens? If there was a witness present, or we can talk to the offending person who lifted the child, then we don't need an RTG. We don't need to send the family to the emergency room. If not, we always have to get an RTG. What is also suspect is the age of the child. If this happens at 6, 7 years or above, we must think of other causes, because by then this radial head should be big enough to be snuffed into the annular ligament. The therapy, we manage this by the primary physician can reposition this using a simultaneous act of supination. So supination is this, and elbow flexion at once. So the action will be supination and elbow flexion. And this should provide immediate relief from pain for the child. And there is no need to do an X-ray after this. So a post X-ray is not needed.